Hello everyone and welcome to this Javik Healthcare video. Before we start, I would like to personally wish you a very happy new year. I hope you had a beautiful Christmas holiday and you're ready and charged for the year ahead. In today's video, I'm going to be discussing what I consider one of the most important parts of nursing practice, and that is documentation. Nursing documentation can simply be defined as a written evidence that shows that a nurse's responsibilities to the patients were met. Documentation can include charts and notes, with charts being an aspect of the nursing process. It includes physical assessments, vital signs done, interventions, and even medications administered. While notes, on the other hand, can be a narrative written summary of the nurse's shift for the day. It can include specific events, it can include hospital visits from friends and relatives, and also if there are events that unfolded in the day and you needed to report to the nurse in charge or call the doctor or even call the emergency numbers, yes, it should be written in the notes as well. So both the notes and the charts, all of this make up nurses documentation. As nurses, we understand that the importance of accurate and good documentation cannot be overemphasized. And in this video, I'm going to list just 7 reasons for you. Number 1, documentation provides a written track record of the care that you have provided. Number 2, written documentation in most cases will serve as a legal document if problems ever arise. Number 3, remember that any care that was not documented just did not happen, even if you were very sure that you performed it. Now, this can result in negligence and may even result in losing your right to practice. Number 4, written documentation can help us in identifying actual and potential health problems and also help us in solving them. Number 5, of course, good documentation helps us in handover. It is just very easy and it promotes continuity of care. In that way, if the next nurse turns up, he or she is able to see what happened the day before, 2 days prior, 1 week prior, and it just helps a free flow of care for this patient and just helps us navigate whatever problems they could possibly have or could possibly arise. Number 6, documentation can sometimes be used by insurance companies to determine reimbursement. And number 7, good documentation can sometimes be used in research to help evidence-based practice. Moving on, I'm going to be sharing with you 10 characteristics of a good documentation. Number 1, definitely make sure that this documentation is written for the right patient. When you're juggling different things, you have 2 or more patients, you might make the mistake of documenting, for a patient that is not even the right patient, be it a physical paper documentation or an electronic documentation. Please make sure that the patient whom you are making a documentation for is the right patient. 2, documentation has to be clear and concise. If you're doing a physical documentation, please make sure that your handwriting is legible enough for others to interpret without any difficulty. 3, it has to be accessible. Please make sure that it's easily accessible because in the case of problems, it's just a lot of hassle to start looking for where the paper chart is, where the notes are, where the electronic documentation has been made. It needs to be easily accessible. 4, it has to be accurate, consistent, and relevant. Make sure that whatever you're writing in documentation is relevant, is something that we need to know. Also bearing in mind that sometimes patients can share something with you that is confidential. So using your judgment as a nurse, you'll be able to know, is this something I need to write here for everyone to see? Is this something that I need to, write elsewhere? Just, be careful when documenting. Again, it has to be relevant. It has to be accurate. Don't write opinions. Opinions are not part of the nursing documentation. Make sure that whatever it is that we're writing, we don't just, put out our opinion out there. 5, please make sure that it is documented in a timely manner. This is extremely important because timestamps are very crucial in nursing. If problems should arise, that is what is going to hold you accountable. Please make sure that no matter how busy your day gets, you are able to immediately document things as they happen or as soon as you are less busy. 6, please remember that nursing documentation should be reflective of the nursing process. The nursing process is a 5-step process. We have assessment, diagnosis, planning, implementation, and evaluation, and our documentation should follow that pattern too. 7, it has to be valid, it has to be factual, and it has to be complete. 8, it has to be dated and time-stamped. This is crucial. This is extremely important. It is just as important as writing the documentation itself. Whether you are writing an electronic documentation or a physical documentation, please make sure that you put the right date and the right time. And even if you were coming back at the end of your shift to write the documentation, kindly make sure that any point you are writing or any part of it you're writing, you can accurately just insert the time at 2 p.m. Say you're writing it in retrospect, you're writing it at 7 p.m. and you started your shift at 7 a.m. You should be able to say at 8 a.m. this happened, at 9 a.m. this happened, 10 a.m. like that, 3 p.m. You don't just put 7 p.m. and then write everything, because then it's interpreted that everything that you've written happened at 7 p.m. So please make sure, I'd rather you write it as things are happening, but if you're going to write it at the end of your shift, kindly remember to write it in retrospect, bearing in mind that the dates and the timestamps should be correct and accurate. 9, nursing documentation should be written with standard terminology. Please make sure that when you're writing your documentation, you use words that every nurse on the planet should be able to interpret. Words that are, standard for nursing practice, but also looking at your own protocol of wherever it is you work. In this case, for Javik Healthcare, please follow our standard terminology. In that way, we are able to easily continue our care without running into problems, and then without thinking, what was she intending to write? And yeah, it just creates hiccup where there should be none. And finally, at number 10, nursing documentation should be truthful and the nurse should be identifiable. I don't think it's right for us to write a documentation and then you keep guessing which nurse wrote this. Your name should be legible. We should be easily identified, and there shouldn't be any questions as to who wrote this documentation. And again, you need to be as truthful as possible. If you didn't do something, please don't claim that you did it. Or if you did something and it occurred in mishap, don't just try to, wiggle your way out of that one. Put it there, and if there's any problem, please make sure you complete the incident report. So this is the end of today's video, and I hope you learned a thing or two. Kindly remember that everything we do as nurses, no matter what it is, that documentation is in fact one of the most important ones. And no matter what we do, no matter how hard we work at work, if it's not documented, it just did not happen. Again, even if you were very sure that you did this, once it's not documented, is considered negligence, and you don't want that. Thank you so much for watching this video, and I will see you in the next one. Kindly remember to like and subscribe, and also turn on the notification bell so that you don't miss a video. All right, take good care of yourselves. Bye bye.